You're good. All right. Welcome, everyone. We are having a special meeting this evening, March 12th. We will discuss our meeting tonight. Let's do a Pledge of Allegiance, please. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, with so many things happening the past 24 hours with the coronavirus and what's happening at on the global level as well as the state level and in our communities, we decided to have a conversation about the special event this weekend, considering revoking the, let me see here. Consider revoking special events permits for the 42nd Annual Aggieville St. Patrick's Day Parade and the St. Patrick's Day 10K and 2-mile races in order to help prevent the potential spread of the coronavirus. And our presenter tonight is Dennis Marstall, our City Manager, Deputy City Manager.
And
good evening, Mayor
Commissioners. While
Mayor.
he's getting ready to do that, I'll just kind of introduce the subject. As you indicated, there's been a lot happened since the close of business yesterday. Quite a bit of movement across the country and region, within the state, on trying to reduce the impact of large gatherings, and that's the focus for considering these permits. We did meet with the applicants and talk to them a little bit about whether they would voluntarily want to consider canceling the events, and they had talked about taking some measures to improve them. We had invited them. We have two different applications that were approved by the clerk's office originally. One was for the St. Patrick's race and run, and then also the parade and the festivities surrounding the parade in Aggieville. And so we certainly indicated to them that we would be bringing this to you all for consideration about whether or not you felt like they should proceed with those or not. So we've prepared a resolution, and I'd like for your consideration, and would like Dennis to review that for you.
Great, thank you, Ron, and to Mayor and Mayor Pro Tem and the Commissioners. We do have a resolution in front of you to consider, but what I think most people will look back on March 12th, 2020 as a historic day, or rather an unprecedented day, as the U.S. and the world work to contain or at least slow the spread of the novel coronavirus, or COVID-19 as it's known in the medical and scientific terms. But as the mayor alluded, given the fluid actions of elected officials, universities, sports leagues, and school districts across the country to address this growing pandemic, which has been identified by the World Health Organization, we appreciate you calling this special meeting tonight, really to help determine how you want to address the health and safety concerns of large public gatherings in the city of Manhattan. But the only item that we have specifically in front of you tonight is related to the events associated with St. Patrick's Day. And so, as you may recall, you have in your information there the 2 special event permits that were requested and approved for St. Patrick's Day, one being a 10K and a 2-mile race, and the other being the 42nd annual parade for St. Patrick's Day. And so those are the 2 permits specifically in question. But as you see through the resolution that is for your consideration, we've really expanded out a little bit, because what is the role of the City Commission as we think about this? When you have the opportunity for the county to work together, the state, the governors to take action related to states of emergency, but what is it for the City Commission? And it does relate to the police power. It also relates to the public health and safety and the welfare, and it is more in context of the global pandemic currently underway for the coronavirus. And so we do see that the U.S. government has declared it a public health emergency. The World Health Organization has declared that we're in the midst of a global pandemic. And then locally, you've seen the federal and state and local governments have taken different actions. You've seen they've specifically addressed St. Patrick's Day parades in different communities, not just in our region of Topeka, Kansas City, but even nationally Boston, and even internationally Dublin. But different governments and different entities have a different lead as they address the public health during this pandemic. Also, you'll see locally, we got word today about Kansas State University and what they are doing, where they have announced the discontinuation of on-campus classes, moving to online distance learning for the foreseeable future. And they also have made a determination about how they will address large events, particularly those involving 100 or more people in any one setting. And so as we look at the permits that are in front of you for the special events, the city clerk is the one, through your authority, who issues the special event permits in the city of Manhattan. They have been granted to the two organizations that are planning both the St. Patrick's Day Parade and the St. Patrick's Day races. So those have already been extended. And as you see, there's already about 700 people who are identified to participate in the upcoming 10K and 2-mile races for the St. Patrick's Day events. And then the parade turnout usually is in the hundreds over the past couple of years. And so as you look at considering this going forward, part of it is looking at what is the role of law enforcement, what is the role of health and safety in these, and how do we work with, make sure we have a public health system that can sustain as this pandemic grows and may even reach Manhattan. And then as we do, what level of exposure could our public safety officials have in such an environment? So as the City Commission, you can exercise the police power to protect the public health, safety, and welfare in response to extraordinary and unprecedented circumstances such as the pandemic. You'll see on there that there are 5 things really about what we've been focused on as the public health. How can we reduce the spread? So one step you can take as you look at this resolution, is this an avenue or method to help slow, contain, or stop the spread of the virus as it may reach Manhattan? Also, as you look at the special use permits, how do we think that will relate to future events? What we do tonight will help us in context for the city clerk to look at future permits that come within the next weeks and months during this pandemic. Also, as you consider this resolution tonight, it is the overall work of, one, this event, the police role, and then what is the public health effect. And so we do work with, as we have on here, we continue to take a strong lead from the county health department as we think about local actions that need to be taken and what role that plays for the city. And so as you discuss or consider this information, we've outlined on here basically the action that we're looking for your consideration on is to direct the city clerk to rescind the 2 special event permits specifically related to St. Patrick's Day events. If you have any questions, I'll be happy to answer those for you. But that's the context of the special meeting that you called tonight.
Thank you, Dennis. Any questions or comments for Dennis?
And I did bring my prop to encourage everyone to
Thank you.
use their hand sanitizer.
Appreciate it. I think we'll take a few public comments. I know there are people in our community that are taking precautions as well. I see Linda Cook and, some other folks in the audience. Linda, would you like to come and speak to what the university is doing as far as some of your preventive precautionary measures? I know that did not mean to just throw you in there, but.
Yes, I'm Linda Cook, Chief of Staff for Kansas State University, and I'll fill this in when I'm done. Just to kind of give you an overview of what the university did announce today, is a result of a number of weeks of work that we have been doing on campus, working with the local, state, and federal health agencies, and trying to understand the implications of the coronavirus and how it could affect communities and campuses like Kansas State University. So we've gone into this with a lot of thought and a lot of research and a lot of guidance from these health agencies and from talking with students, with faculty and staff, and parents on what we do going forward, because we know the decisions that we may have an impact on a lot of people in a lot of ways. So as a result of some of the recent events that have happened across the country and some of the decisions made regarding travel and some of the states of emergency in different states and different cities around the United States, and what we were seeing happening at universities in these different parts of the country, that's when we started to take a look at what should we do for Kansas State University. In particular, knowing that we had a lot of students, well, first of all, we started with bringing our study abroad students back from Italy because of the crisis situation in Italy, and got them back to Manhattan and working in the self-isolation process, and providing the Jardine apartments to help keep them isolated. There's certain levels of isolation versus quarantine that are very much guided by the health department and working with Lafine, our health organization, as well as the health officials here in Riley County and in the city. So then the next step was taking a look at, with all the students going on spring break, going to locations we have no idea where they were going, all parts of the country and across the globe, and then coming back. What we wanted to do is avoid a crisis on campus and in the community. As the health experts explain, and you've probably seen in the news, what you want to avoid, and this comes from experience and watching what happened in Italy, what's happened in New York, what happened in the state of Washington, is that you have a high spike. If you have people coming back and are congregating in close proximity to each other, like classrooms and on campus. And unfortunately, that spike goes higher than what most healthcare systems can accommodate. And what we're seeing is that what they call the social distancing is what the health professionals call it, is to keep people separated. And what that does is lower that spike, and it ultimately affects fewer people, maybe over a longer period of time, but it keeps it under that threshold for which most healthcare systems can handle. So with all of that information and understanding what was going on with other universities in the state and across the country, the decision was made, and we announced it today, that we are suspending all classes on campus the week of March 16th and 20. Online classes will be held. If students do not, and we're suggesting and requesting that students stay home versus returning to campus, but if they don't have a place to go, they can come to campus. The dorms will be open, and we'll be able to accommodate them that way. And then beginning on March 23rd, the classes will be taught remotely, and that's what we're working on with the faculty and staff. And how do we handle these remote classes? How do we make sure the students are getting the education that they need and the evaluation that they're maintaining their grades and they're gaining, or they are actually meeting the requirements to be able to pass those courses. That will go on for an undefined period of time. That's where we have to watch what's going on over the next couple of weeks. But for now, we're just saying that that's happening until further notice. We're suggesting that employees also have concerns, and that we're making accommodations for them to work by telecommuting, and have things set up for them to be able to work from home. They can come into the office if they want, but when you're dealing with someone's health, you want to be able to give them every consideration that you can. And we do have a number of employees that are concerned, and that we're making the arrangements for the telecommuting. We're urging visitors to postpone any campus visits, and are working individually with different groups that have made arrangements to come to campus. We are also, for large campus events with an attendance more than 100 people, we're strongly encouraging those to be canceled. And in that regard, for our McCain Auditorium, we have a number of large sold-out performances in March. We have made the decision to cancel those performances through the end of March. Those people will be refunded for their tickets. We will monitor what we need to do beyond March, but for now it's the March shows that have been canceled. Beach Museum also is another area where we've had some events. We're canceling those events, closing the Beach Museum, allowing those employees to work from home as well. And again, it's protecting the public as well as staff at Kansas State University. And we're looking at all of our travel policies, really scrutinizing any traveling in any of the countries where they have the CDC warning levels of 3 or State Department travel advisories. We're not allowing people to travel into those on any university-sponsored trips. So again, that social distancing we think is important to help us avoid a spike on campus and hopefully keep things and keep everyone healthy. In addition, athletics did announce this afternoon that in concert with the Big 12 Conference and what the university is doing, that they are, for all season competition, that's home and away, is suspended until Monday, March 30th. All out-of-season practices are suspended until March 30th, and all recruiting travel for coaches is suspended until March 30th. So that's the latest. We continue to watch it. Of course, we had a lot of phone calls today asking questions about how we administer this, and we have a lot of plans and policies and processes in place. But as we go through this, we're also learning new things that we have to figure out in the process as well to help guide staff on what decisions to make. But we felt in the interest of the health and safety of students and the health of our staff and also for the community that these were the best decisions to make.
Thank you, Linda, I appreciate it. Good information.
Thanks.
We also have Julie Gibbs here from the Riley County Health Department. Julie, would you kind of just tell us where we are at with the coronavirus, and as far as the community and as it pertains to Manhattan, but also the state in general, and what precautions we're taking here?
Sure. So we're still considered low risk in the county. Okay, thanks. I can keep my hand off of it. We're still considered low risk in the county. We want to keep it that way. So what they're doing at the university is great. Social distancing is something that we want to do in the community to keep us at low risk status. As far as Kansas, I just read a report that came out about an hour ago. They've had about 72 tests that have been administered at KDHE, 4 positive in this state. So yeah, our goal at the county level is to keep us at that low status. So I agree that we need to do more social distancing. We're doing what we can as far as putting out information to the public. We send about 4 to 6 Facebook posts every day, making sure that they're coming from a reliable source, CDC, KDHE. We've been in contact with all the healthcare providers. We currently have a site for all the healthcare providers so that they can be in contact with each other and all sharing that same information. So we do have a plan in place if this were to get a little worse, and we're ready for that. We're prepared as a county, but again, I can't stress enough that we want to stay at the status of low risk, so we need to be looking at proactive measures such as what we're discussing here tonight.
Thank you, Julie. Questions for Julie or Linda or staff or anybody? Well, I have a few comments before we make a motion. Sorry? Oh, any other public comments? Sorry. I didn't. Come on up.
Dennis Cook, Aggieville Business Association. We'll tell you that, that as we had a meeting today, we do recognize that everything is changing rapidly, and we don't want to be on the wrong side of that. But on the other hand, we were talking about our events for coming up for this weekend are all outdoor events. They're different than indoor events, and from an economic standpoint, we're not a big entity. We represent a lot, about 110 small businesses, and these kind of events are crucial for them, and that's why we've held them for 41 years and hoping for 42. And but I do recognize that there's, even from this afternoon when we met at noon, that things have probably changed some, and so we don't want to be on the wrong side of that. But I guess our thinking is can we consider outdoor events that are being held outdoors, like what we're doing, I'm also representing, I guess, this evening, the race. They weren't able to be here because they're still busy handing out packets and all that. And they're a little separate entity from us, but they are they're right down there too. And they've pre-sold a lot of that. And, when they actually have people congregate, it's, just before the race starts, and then they're off. And then when they come back, they've got some plans on how to, they've said they're going to cancel their awards presentation piece and all that. So that's the race side. So they're really hoping to get going. And for us, for parade, it starts at 1, it's done by 2. It's, it covers that, really the 2-block stretch in Aggieville. And if that's not enough social distancing, then that's what I want to hear. And otherwise, we were hoping that being an outdoor event could go on. That's our thoughts.
Thank you, Dennis. Thanks for Dennis.
Okay.
Other public comment? Anything from RCPD or any other members want to add anything?
I'm wondering, Julie, from the health department, about the difference between indoor and outdoor, if there are any guidelines or if you have any information.
Yeah, so it comes down to, I think, the time of the event and just how close in proximity the individuals are, whether it's indoor or outdoor. I've been to parades before. I've been to that parade before, and I know that the sidewalks are full, and it's hard sometimes to find space. So there is that close proximity, and that's what we're concerned with this.
And a race, is that different than the parade, or?
Yeah, it can be. And the way that the race directors presented it to us earlier, with the precautions that they're taking, I think it can be different than the parade, because they are limiting with the exception of they're doing away with their awards ceremony. They're doing away with food, so they're basically just pushing it out as, you can run this race and then go home. So it can be a little different. They're trying to limit the number of people and limit exposure that way. So I think that can be different.
Okay, thank you.
I would just like to preface everything I'm going to say with the fact that if you're in a immunocompromised position, you've got heart, lung, breathing issues, you're elderly, take all the precautions you can. The rest of us, this thing is way overblown as far as any kind of mortality, fatality. The peak for the number of cases in the United States was 40 10 days ago. And so it's already, and it's maybe because of all the things they've been doing, but because it's not here in Kansas, I hate it when government does knee-jerk overreactions. And canceling this comes across to me as a knee-jerk overreaction. This really isn't our realm. It's a private group having a parade, and I know they're using our streets, but it's a private group putting on the parade, putting on the race. And if they want to go ahead with it, and if nobody shows up because it's going to be 38 degrees at 1 o'clock, I think people are going to self-disqualify themselves based on the weather. And people still have the right. No one's holding a gun to their head saying you have to go to the Aggieville parade and race and be exposed to other people who probably aren't sick and probably don't have the coronavirus. We're taking the choice of the American people out of the equation here when there's not really any reason. We're not in a health crisis. There's nobody saying, oh my God, it's in town, it's creeping up the street. And even if you get it, the average healthy person is going to be fine in a few days. I'm looking forward, and I hope they advertise when Tom Hanks and his wife get better. I hope in a few days, I hope they blast that across the news as quickly as they did. Oh my God, Tom Hanks has got coronavirus. Well, he'll be fine in a few days because he's generally a healthy guy. Now, there's nobody that's from a nursing home going to be down at the race in Aggieville on Saturday. It's going to be too cold for anybody with breathing problems who would be susceptible to the coronavirus infestation down in Aggieville because it's going to be too cold. We're not people's mothers, if somebody wants to stay home, if somebody wants to keep their kids home, that's your call. It's not our job to tell the public, you've got to stay home because it might be dangerous out there. Let people take a risk. And I think the risk is very low. There's no cases. There's only 1 or 2 in Kansas. There's nothing in the area. People from the outside might be coming here. But even if you get coronavirus, anybody that's old enough, young enough to be out in Aggieville in 38 degrees on Saturday is going to be okay, because it's only of the 35 people that died, 20-something of them were in a nursing home. Those are the at-risk populations, and they're not the ones that are going to be in Aggieville. So I just would like us to step back for a second. There's no reason that they have to cancel everything. This March Madness canceling is just madness, because even if people get the coronavirus, the common cold is a coronavirus. And so even if you get it, you're not going to die from it if you're a reasonably young, healthy person. And I preface this all with, if you're at risk, stay home, take precautions. If you're young and vibrant and able to run in a race, if you're young enough to be out in the cold on a 38 degrees thing, I would say you're taking whatever risk from being out in the cold is a bigger risk than potential exposure to the coronavirus. And like I said, even if you get it, if you're young, you're going to be fine. And it's already kind of on the downslope here in the United States, and maybe because of what they've done so far, which is working. So why do we need to add more screws to everything to tighten it down farther? That's my perspective. We're overreacting. It's outside. It's cold. There ain't going to be a very good turnout anyway. Let them have their event.
Thank you. Other comments from Commissioner? What? Oh, yes. I didn't know we were switching back and forth. Okay. Dennis?
Yeah, just to repeat a few of the comments from the noon meeting, since not all the commissioners were there. I think we all realize we're in uncharted territory here. But from a law enforcement perspective, a couple of thoughts that I expressed earlier today that I'll share again, and there has been a development that affects us that I'll share as well. We understand the limits of our authority as a police department when it comes to preserving life, protecting property, and preserving order as well. And there's no authority for us in this situation to intervene in these events that have been scheduled. We have planned to support them both, and those plans remain in place, and they will as it stands right now, and will be available for the parade and for the race, and any subsequent events that are planned later in the month in Aggieville and other places as well. The other side of that coin is, we have employees that have to support these things, and so we've used the health department guidelines and precautions to share with our employees. We're prepared to do many things as far as letting them work from home if they can. If they're sick, we're encouraging them to stay away. If they've been around somebody sick and they think it could affect our workplace, we don't want them to come and share that with us. As you know, because of the kind of work we do, the work at home option is limited. Dispatchers can't work from home. Correctional officers can't work from home. Patrol officers can't work from home. So we are being extra vigilant when it comes to making sure that they practice the types of precautions that you hear about to keep from becoming infected. The late development today, for what it's worth, is we received word from the Kansas Law Enforcement Training Academy that they're closing tomorrow for 3 weeks. We have 2 recruits that are there now that are scheduled to graduate next month, and we have 2 that were supposed to start on Monday. So now we are in limbo for several weeks in terms of getting people trained and out on the street. So that happened around 4 o'clock. I received word of that today. So in summation, we're going to continue to do our jobs. When 911's called, you should expect an officer to respond. And if we find ourselves in a crisis because of this, we will certainly let you know and the community know. And we have other options in place to try to deal with that if it does happen.
Thank you. Comments? Oh. Comments from commissioners? Either? Oh, Mark has one more thing. I don't know, do I need to officially say that? I haven't ever. Is there any other public comment? Seeing none, public comment is closed. Go ahead, Mark.
I got one last thing. According to the CDC website earlier today, out of the 1,215 cases that they've got reported on their website, they attribute 125 of them to people traveling. They attribute 102 to close contact with somebody, and 988, 80% of them, they don't know how the person got it. So we can't say that it's always going to be close contact. That's only 8% of the ones that they've identified how the person got it, 8% of them because of close contact. And so there's a whole bunch of, most of the people, they're still under investigation as to how they got it. So we can't always assume. Most of the time viruses are going to be transmitted from people through the air and coughing and sneezing, and so all that protection is a great idea. But it's not like we're talking about tens of thousands of people, 10,000 people died from the swine flu or something, and nobody got near as excited about that as they have this thing.
Thank you. Aaron?
So I just got a report, I don't know if you all did too, but one of the 4 that was diagnosed in Kansas has died of the coronavirus. That was issued by the governor just a few minutes ago. I would disagree that it's not increasing and the trend is not going down. But one thing that I heard on my way in here that I think is somewhat shaping my thinking is the mayor of the Big Apple, not the Little Apple, but was talking about the 80% of people affected are what Commissioner Hadisall is describing as mild. You know, we're not going to have 80% of those people are going to be just fine. It's the 20% that any kind of precautions, any things that are limited, that are going to have these problems. And somebody has died, a Kansan has died in Wyandotte County just today. Our schools are also important. This is an education community. This is a Fort Riley military community. They're doing things also. And so what we heard from the Commissioner of Education today is that if there's a student that is in one of the school districts, KDHE is going to basically close that school district for 14 days. Is our parade, is our events contributing to that? Who knows? But what we don't know is what we're talking about and why it's unprecedented. So I don't really have too much of a concern, given that what we can control is in front of us, and we can't control some of these other things. We can't control a virus that may or may not evolve, may or may not come to Manhattan. We don't know the lethality of it, but it is apparently deadly. So I think I did have questions about the race, given that they're taking precautions and doing things, but the size and the number of participants and the fact that, you know, this is still evolving and people are dying in Kansas now changes my way of thinking a little bit, that if we can pull back on the permits, it makes a lot of sense that we can control that. I don't want to get into, I wish we could have a unanimous decision. I wish we could get behind this and be on the side of fighting for public health together, and not turn it into a political issue and battle over, make this some kind of partisan overreach of government type of argument. I think that we all don't know enough for it to be presented that way. We need to move forward with what we do know and kind of control what we can.
Thanks, Aaron.
I would just say that I take seriously the mission of the City of Manhattan and our commission involvement, and that is to do our best to protect the safety of the citizens in our community. It's important to look to Kansas State University and the Board of Regents and the County Health Department and the Kansas Department of Health and Environment These are the big influencers with regard to what's happening in our community and what's happening in the state. And the State Department of Health and Environment and the Public Health Department are the people with regard to the science of this, because we can't, as commissioners, pretend to know what's going to happen and how fast this virus duplicates itself and who it will affect. But I think we have enough people, enough public entities leading the way for us that we need to be responsible and make a decision that fits with that. We don't want our whole community to be concerned, and we're just pretending that business as usual, because it's really not business as usual. We have to be responsible, and I don't know any other way to say it. So with regard to your question about what we're supposed to be talking about here from Dennis, let's see. The two items are about the, but I wanted to just talk about the city clerk's role here. Is to receive applications and review them, and as long as they are acceptable. But there's no way she has a crystal ball into when a virus is coming, when she processes an application. So I think the city clerk has performed fine. I don't see any fault there. And I don't fault the organization. I think in these other communities, the Kansas City St. Patrick's Day events, the festival and parade, in the Topeka Festival and Parade, they are sponsored by local organizations who have voluntarily pulled the event and said, this is not a good idea. We need to not go forward with this for the safety of our community. In this situation, we happen to have an organization that's more commercial and is resistant to canceling it. And so I just want to be sure that we keep things in perspective too, that we are not an island here. We are very much influenced by the external, and I just would want to err on the side of keeping our residents safe. And for sure, I think the parade and the crowds that usually are associated with that parade, so much so that if you're a driver in that parade, the children come so close to you that it's kind of frightening to be a driver in that. I don't expect that many people there, because I expect parents to keep their kids home. I don't expect people to be out and about like is any given day. But I do know that parade is more intense. I'm having trouble with the race, but it seems to me it doesn't have to be in the crowded area. It'd be easy to move it to a location where people can maintain. And I realize a race, you are separate, but it sorts out over time. They all start in a concentrated mode. So I was really interested in the health director's comments with regard to the race. I'll listen to some more comments about that before I can figure that out, so.
Quick. So the governor has declared a state of emergency, so we'll have to update the resolution if that is in there. So things are continuing to evolve, and I just wanted to add that I have a problem with this because it's not so much the events themselves, and I think it's the fact that we can be transmitting things. I have a 103-year-old grandma that she survived everything for the last 103 years. I don't want to be the reason that somebody carries something back to her. And also with having young kids, we're a transient community. We're proud of that in so many different ways, but it also leads to different problems that we have here where we attract guests that come and go, and races also do that.
Okay, so where does this stop then? Why don't we just close Aggieville? Because as soon as the race is over Saturday night at 11 o'clock, there's going to be the usual 3,000 or 4,000 people in Aggieville. How is that going to be any different than having 500 people milling around Aggieville during the day? They're still going to have gobs of people milling around with each other. Why don't we close Walmart? There's got to be 400 people wandering around Walmart now. What's left of the shelves at Dillon's are packed with a couple hundred people there, interacting, touching the same carton of milk and stuff. Where do we stop this if we're going to go crazy about blocking or stopping and eliminating things so there's no congregation of people? We should go home right now before we interact with each other any longer. In fact, that's a good idea. But where do we draw the logical conclusion to this? Does every time there's 10 people, we have to cancel that? What is the difference between Aggieville after 10 o'clock at night and Aggieville at 10 o'clock in the morning? It's still a bunch of people. We're not going to close Aggieville in the evening. Why are we closing Aggieville in the morning or noon?
Well, let me just answer some of the, I understand why you're angry. Understand this is not everybody's favorite thing to do at any time. And this is an anomaly because this is the first time we're doing this. That's why this is so unusual when we're trying to redo an event. We are trying to control what we can. People are still going to go wherever they want. We're not saying stop shopping or stop going out to eat. That's not the point here. We are doing what we can to control what we can, so we are still at that low risk or zero. We're trying to contain it. We will move on with the discussion, but I know Wynn had a few things to say as well, so.
My concern is, nobody's really said it, it has economic impact, of course. That's why the people don't want to voluntarily cancel it. I agree with Mark that, we've got, excessive panic. People are just not looking at the data, I think, properly. And I also think that sometimes the government may contribute to that panic by, overreach, by canceling things that really isn't going to have any impact. Like I'm thinking, I got several emails today, people saying you're going to cancel Fake Patty's Day. Can't do that. Why? Because there's no permit. That's why. And Mark sort of hit that on the head. There's no permit. So all you're doing is pulling a permit. That's it. You're not changing behavior. People still gonna do what they want to do. And I get it. We got some people running in the race, 1,000 or so? How many of them are going to be traveling into the city? That's what the real concern is. Not people in the city running the race, because you're already here spreading the virus if you have it, right? So it would be outsiders. And I just have a problem with enforcing the thing, especially with the fact that right now there's zero evidence that the virus is here. If it was already here, it'd be different. And so, there's a dilemma there. I also think that, a lot of people want us to cancel it because it'll make them feel better, because then they won't be in the panic mode. And it's more of a feel-good sort of gesture. And I'm not sure we're going to accomplish anything on public health by canceling the event, because people are still going to go to Aggieville, they're still going to go to Dillon's. It's not the same as Kansas State University, where I think it makes pretty clear if people are scattered all over the world and they come back here after spring break, are the chances of bringing it in from some outside location greater? Probably. But I'm not sure this is the same thing. And then I get back to Fake Patty's Day. Is that going to voluntarily be closed down by the bars? Because the city government ain't going to close it. And I see Dennis shaking his head no, that's not going to happen. So whatever, we're going to have a problem with people intermingling. We're not going to be able to stop it.
So I've been talking to Ron for, what day is today? Thursday? For a few days now. Yesterday we were on a call with the federal agencies for about an hour, from the Department of Commerce, Department of Labor, Homeland Security, a variety of department heads, having a conference call with over 800 local elected officials, and they gave us lots of information. I think I had communicated with our city manager and mentioned that maybe this is something we should look at. with the events that have been taking place at Kansas State University, with the World Health Organization calling it a pandemic, with what's happening in Italy. And what happened in Italy was because people didn't see a sense of urgency. And that's why they had to elevate it to pandemic, so we have a sense of urgency. Not having any cases in Manhattan is exactly where we want to be. That's where we want to be. And so I felt we need to control what we can. Students not coming back is going to have an economic impact on our community. Students not being able to do their hourly jobs is going to have an economic impact on our community. Conferences and conventions being canceled is going to have an economic impact on our community. People not being able to pay their rent, their utilities, or anything else in their life because they don't have the income coming in because they can't go to work is going to have an impact on our economy. If those are decisions that have been made, knowing that's going to happen, the threat must be pretty high. And if we look the other way and say the threat is not high enough, why are you going through all of this? Then we are taking a chance that nobody is going to get ill and nobody's going to die in our community because of the coronavirus. I'm not going to take that risk. I'm not going to take that risk during my tenure. And if we don't do something, then we are not taking all of the red flags that are in front of us and doing something on our own as well. This is a small part of what we can do. We cannot cancel Fake Patty's Day. We can't, people can go shopping, they can go whatever they want. We are not canceling any of those things. We are controlling what we can. I feel we need to take safety precautions to make sure we reduce the spread of the virus. Young people go all over the place. We don't know if they have a virus to spread or not. They may be living with grandparents. I don't know. They may be visiting their nursing homes. I don't know. You know, children live with their grandparents. The school district is going to discuss what they're going to do. And this myth that it only happens to the elderly also needs to stop. If you have a weak immune system, or you have respiratory or allergies, or anything that makes you a little bit susceptible to getting ill faster, then you are at risk. We don't want to put our healthcare departments, our hospitals, also having a high volume of people coming to get tested because they don't know if they have it or not. That is something we are trying to stop as well. We also want to make sure that when people, if they don't have school, one of the discussions they're probably going to discuss is how do they get food? I know as a first grade school teacher, a lot of people that were on free and reduced lunch, one of the things we worried was during spring break and Christmas, how are they going to get food? Because they would eat in our cafeterias. These are implications of what we are discussing. And the threat is high enough to have those discussions. You mentioned there was a death already. When I came in, there was 4 cases. So if somebody has died, that's a pretty big deal. And most people who have symptoms, you don't even know you have symptoms for several days later. You're walking around normal, touching everything. We talk about social distance, but I already hugged a lot of people today and I shouldn't have. I've already shaken people's hands and I shouldn't have, just out of habit. And I can't say that I washed my hands singing happy birthday all day long yesterday or anytime at all. I wash my hands like I typically do because they're just habits that we have that are hard to break. We touch doorknobs, we touch laptops, we touch mouse, we touch everything all day long. And we are trying to stop people from touching. And the best way to do that is not to have 700 people in one area at one time. That's how you can manage that social distance. I talked to the superintendent, Marvin Wade, earlier. I've been in communication with Linda Cook. I've talked to our RCP director about this, our city staff as well. Julie Gibbs from Riley County Health Department, John Ford from the Riley County Commissioners. So I've had as many discussions as I can to make sure we are doing everything right. We had an afternoon meeting with the Aggieville Business Association. We are trying to control it. People can still come and visit, do whatever it is they want to do, but I feel as an elected official, our primary job is to take care of our community. And that's why I feel we need to revise this ordinance and look at revoking the permit. It's not a position I want to be in, because when it comes to making those budget decisions come April, May, June, July, we will see this impact on our budget. We will see not just that one, but what's happening everywhere else. that's going to impact not only Aggieville and downtown, it's going to impact everyday living for a while. And I think those are things that we will have to look at closely. But it's a pandemic. And having few cases means we are doing something right. Having the least amount of cases and the least amount of people that are dying means we are doing something right. I don't want to be on the other end where saying, wow, we didn't do enough, we weren't proactive enough. That's not where we should be. So I am in favor of this resolution and trying to do what we can. That doesn't mean people can't go out and have a good time. What we are trying to do is remove hundreds of people in one area. People still go to church, people still go to whatever events they're going to be going to. That's not the point of discussion tonight. So that's why I feel like we are where we need to be on this Thursday night to look at revoking a permit for 2 occasions for the parade as well as the race.
Ms. Gibbs, do you know how many people in Riley County have died from the regular flu this winter?
I don't know that off the top of my head.
Has it been any kind of an epidemic or anything?
No, it was not declared an epidemic. Sure.
I'd be curious to see, because as of right now, yeah, 1 person has died of the virus, and I'd be curious if they were immunosuppressed, at-risk person to start with. I'll stop there.
Can I, in terms of capacity, I've been wanting to know that, and especially when it comes to this being a respiratory issue and ventilator, this isn't about a parade or a race to me. It's about us preparing. If Mark's right, Commissioner Hassall's right, it's all for nothing, and that's great, and we can just look back and say, Commissioner Estabrook, what were you thinking? Why did you do that? And that'll be great. But if it's not, and we aren't prepared, now's the time to try to get prepared. And so I'd like to know, well, a few weeks ago was probably the time, or months ago, but I'd like to know where, if you know, we're at when it comes to ventilators or capacity with beds or anything like that.
I know that was a concern with our healthcare meeting our healthcare provider meeting that we had last Friday. That was a huge concern of the healthcare providers is what are we going to do when people come back from travel with spring break? They might think that they're infected. 85% of them might not be, but they're still concerned because they're having those same symptoms, so they want to be tested. So that's something that we're having to look at now and having to prepare for, because that is a concern of a lot of healthcare providers with the testing and just with that influx of individuals that will come back with symptoms.
And the person who died in Wyandotte County was in his 70s, so he was at risk, and he probably wouldn't have been at at a St. Patrick's parade. Anyway, but the point is, but my point is still is that like I prefaced everything I said, if you're at risk, you need to take precautions and avoid everything that you can.
But you understand that the carrier is the reason we would do this. It has nothing to do with preventing people from coming. I mean, that is just, you have to understand that.
The carriers may not be 70 or anything. Those are the ones most susceptible. I might be carrier, I don't know. I don't know. It comes in all ages, so.
I think we're all in different stages of discovery, too. I've been out of town all day. I have not been involved in not one, of the preparatory community meetings for this issue. And I don't know about the other commissioners, but we only know what we've heard tonight. I only know what I'm hearing tonight, and I'm making my decision on that.
If there's no other comment, are there any public comments, even though I closed it? No. Well, I'm so used to asking it afterwards. Sorry, I keep forgetting what I'm doing here. Is there a motion? Does everybody have a motion?
So does the motion consider both the parade and the race, or is it's the 2 events, right?
2 special events.
Do we want to well, I move that we approve Resolution 031220-A, finding a public health and safety concern related to the coronavirus COVID-19, and directing the city clerk to rescind the 2 special event permits related to St. Patrick's Day activities in the city of Manhattan scheduled for March 14th, 2020.
Is there a second?
Second.
Please call the roll.
Mayor Reddy,
Yes.
Commissioner Butler,
Yeah, I'd just as soon not vote on it, but I'm gonna vote yes because I think it, the panic has got to stop and some people are gonna feel good about it. So this is one of those feel-good ordinances. It's not gonna make any difference, but it makes you feel better. Don't panic. It's not a pandemic, not in Manhattan, Kansas.
I vote yes.
Commissioner Morse,
Yes.
Commissioner Hattasol,
No.
Commissioner Estabrook.
Yes.
Motion carries 4-1.
Okay, and with that, we are adjourned. Thank you.